We touched on AI in Module 4, but the policy implications are massive. If an AI doctor is more accurate than a human doctor, is it unethical not to use it? But if the AI is a black box that cannot explain its reasoning, does that violate informed consent? We are moving toward a world where the algorithm allocates resources. It decides who gets the liver transplant and who gets the ICU bed. Policy must demand explainable AI. We cannot outsource our morality to a machine. We need laws that keep a human in the loop for all life or death decisions. In 2018, a Chinese scientist named He Jiankui announced he had created the first gene-edited babies using CRISPR. He altered their germline, meaning the change would be passed down to their children. The global scientific community was horrified, but the genie is out of the bottle. We face a future of liberal eugenics, where the wealthy can buy better genes for their kids, higher IQ, better height, resistance to disease. If we don't regulate this, we could create a biological caste system where the rich are literally a different species than the poor. Policy must draw a hard line between therapy, fixing disease, and enhancement, improving performance. COVID-19 proved that pathogens do not respect borders, yet our response was fiercely nationalistic. Rich countries hoarded vaccines, while poor countries waited. This vaccine apartheid was a moral failure and a strategic error, as it allowed variants to breed. Currently, nations are negotiating a WHO pandemic treaty to bind countries to share data and resources in the next plague. The conflict is sovereignty versus solidarity. Will the US and China agree to give up some control for the common good? The future of human survival depends on global governance structures that currently don't exist. The biggest bioethical threat is climate change. It is a health crisis. Heat waves kill the elderly. Tropical diseases like dengue are moving north. Droughts cause migration and war. This introduces the concept of intergenerational justice. Do we have a duty to the unborn? Does the current generation have the right to use up the carbon budget and leave a sick planet? Traditional bioethics focuses on the patient in the bed. Future bioethics must focus on the planet as the patient. Demographics are destiny. The world is getting old. The silver tsunami means we will have fewer workers supporting more retirees. This will break the Medicare Social Security model. We will have to rethink end-of-life care. Is it ethical to spend 30% of our healthcare budget on the last 6 months of life? We may need to move from a goal of life extension to compression of morbidity, keeping people healthy until the end rather than just keeping them alive. Neurotechnology is advancing. Companies like Neuralink are building brain-computer interfaces. This offers hope for the paralyzed, but it opens the door to reading thoughts or modulating emotions. We need a new right, cognitive liberty, the right to the privacy of your own mind. If a court can subpoena your brain data, freedom is over. Policy must build a firewall around the neuron. We are also facing an epistemological crisis, an infodemic. Public health relies on shared truth. If half the population believes vaccines contain microchips, policy fails. The erosion of trust in science is a public health emergency. We need to debate the regulation of social media algorithms that amplify disinformation. Is free speech absolute when it causes mass death? That is the First Amendment battle of the 21st century. Given these threats, bioethics is changing. It is moving from a consultant model, doctors asking philosophers for advice, to an activist model. Bioethicists are marching in the streets. They are realizing that you cannot be neutral on a moving train. If the system is producing unjust outcomes, the ethical act is not to analyze it, but to change it. This political turn is uncomfortable for academics, but necessary. To conclude, Lesson 4, the future is scary, but it is not written. Technology is a tool, not a destiny. We get to decide how to use CRISPR. We get to decide how to use AI. Policy is the mechanism by which we impose our human values on our tools. In the final lesson of this course, we will bring it all together. We will talk about ethical leadership and your role in this future. Don't forget to submit your policy brief. Take a moment to reflect on what we discussed in week 1, your great object. What is the thing you want to change? See you at the finish line.